we need. Speak to the issues that are affecting people right now and try and find relief for folks based on the authority of your office. But I don't know what this guy is doing.
Senator Harris, this is Meghan again. I think that's a very patriotic and noble idea, and I hope that bill gets passed, because you're right. How can we expect people to pay their bills when they're incapable of working? On a totally separate note, I want to ask you about something that's really, I think, disgusting and very hard for the American public to watch, and that is the absolute disproportionate impact that the coronavirus is having on African Americans.
Yeah.
In Louisiana, 70%, this is insane, of the deaths are African American people. We are seeing similar racial patterns in other states here in New York City. What should we do? Why do you think we are seeing this disparity? And if we don't do something about the inequality, will this country be able to recover? One of the options we thought on this show was maybe FEMA needs to start sending in extra medical care and extra medical tents into some of these cities and areas of the country that is being hit so hard.
Thanks for bringing that up, Meghan. So the fact is that during a crisis, it magnifies the disparities that existed before the crisis. And in a crisis, people who are doing bad do even worse. And so on your point about racial disparities, we know that African Americans and children are 20% more likely to have asthma. The African Americans are 40% more likely to have high blood pressure. Black women are 3 times more likely than white women to have lupus, which we just discussed. Sickle cell anemia, one of the things that threatens anyone who is living with sickle cell anemia is a respiratory virus. So those who had pre-existing health conditions based on racial disparities, based on socioeconomic disparities, are doing even worse in the midst of this pandemic. And so it requires us to address it in a way that also recognizes the historical nature of it. For years, I've been working on Black maternal mortality, which before this pandemic was very real. We were talking about it. Black women are 3 to 4 times more likely to die in connection with childbirth than other women. And when we looked at the issue, it had nothing to do with that woman's education level or her socioeconomic level. It literally had to do with the fact that when a Black woman was walking into a hospital or a clinic or a doctor's office, she was not being taken seriously. So these are issues that have to be addressed, and you pointed to one solution, which is about FEMA directing resources to